Hi, I'm Ellie Rowe with WTOP News. The DC community has come a long way since the world shut down in spring of 2020 when the pandemic broke out. Over the past 2 years, life has shifted in and out of lockdowns, mask mandates, and an increase in outdoor activities that enabled gatherings during a time of viral transmission. While many may feel we've reached the end of COVID, the virus has not and may never completely go away. The medical community has indicated that COVID-19 is now endemic to the U.S., which means we'll be living with it indefinitely, but in a less devastating capacity. And now that we're armed with vaccines, ramped up production of masks and tests, and other preventative tools, much of our lives can go back to normal. But what does that actually mean? And how should we be thinking about transmission, infection, and prevention while navigating present-day realities of living with a virus? I got to chat with DC Health's Chief Science Officer, Dr. Anjali Telwalkar, who provided insight for us.
My guest today is Dr. Anjali Telwalkar, the Chief Science Officer at DC Health. Thank you for joining us today.
Thank you.
So my first question, as it relates to COVID-19 and the pandemic that we've all been experiencing over the last few years, is what are COVID-19 community levels?
So community levels are a new tool that was developed by the Centers for Disease Control and Prevention to help us really understand the burden of COVID-19 disease in our community, the burden of COVID-19 on our community at this stage of the pandemic in 2022, and to also help us know what actions we can take, what preventive measures we can take to protect ourselves against COVID-19.
So tell me a little bit about the reasoning behind the switch to the new COVID-19 community levels.
Sure. So we switched from tracking community transmission to this new definition, which I'll go over around community levels. And it was really to recognize all of the tools that we have in our tool belt now compared to previous phases of the pandemic. So what we have now that we didn't have before are vaccines that prevent severe disease. We have therapeutics or medications that help prevent progression to severe disease. We have more than enough tests, and we have more than enough masks. So all four of those things, all four of those sort of preventive measures and treatments are so hugely important and have put us in a completely different phase of the pandemic. We're now, while we always want to limit transmission, limit infection, our primary goals now with the tools we have are to prevent severe disease, to prevent hospitalization, and to prevent death and lives lost from COVID-19. And at the same time, also to preserve the capacity of our healthcare system to make sure that that system doesn't undergo any strain, so it can treat not only COVID-19, but also all of the other conditions that people have to get care for, many of which have gone unchecked over the last 2 years because there has been less preventive care, less routine care. So now changing to levels, we're really able to make sure we're laser focused on preventing severe disease and protecting our healthcare system.
So do the COVID-19 community levels mean that COVID no longer poses a threat to most of the country?
So it's not that it doesn't pose a threat. It is a virus that is here, likely to stay. It's something that we're going to have to sort of manage, like we manage other risks in our day-to-day lives. But we are in a different place. So I think we like to say that we should remain cautious about COVID-19, but we don't necessarily need to worry or be overly anxious about it because we have so many tools to help protect ourselves and protect our loved ones from severe complications. So it's just a different way to really look at what is going on with the disease in our community so we can take the appropriate measures to protect ourselves.
So in DC, what are the current COVID-19 community levels and what determines that for us?
Sure. So our community level is currently low. So there's 3 different community levels. It's low, medium, or high. And there's 3 different indicators or measures that we look at that feed into what your level is. So we look at new cases of COVID-19, and we look at a weekly rate. So that's new cases per 100,000 of the population. Then we look at 2 different measures around hospital capacity and use. So we look at new hospital admissions for COVID-19, also per 100,000, and then we look at the percent of staffed inpatient beds, so beds in a hospital, that are actually occupied by COVID-19 patients. And those three indicators give us a good sense of the burden of disease on the community, of the capacity of our healthcare system, as well as how much severe disease we're actually seeing. So COVID-19 has a very broad spectrum of symptoms that people can have. You can be asymptomatic, meaning no symptoms at all, or you could need to be in the hospital and be on a ventilator. So we're really looking to minimize that severe disease. So even if you feel maybe under the weather for a few weeks because of COVID-19, we're really looking at clinically significant disease, meaning disease that requires hospital care, maybe being on a mechanical ventilator and more intensive treatments. So looking at those three indicators, we look at whichever one has the highest measure. There are thresholds set by the CDC for each of these measures. And then we look at those three sort of values or numbers in combination and then determine the level from that.
Now that we've been in this for a few years, obviously we've seen some trends over that amount of time, but is there any way to know if our community is at risk for the highest COVID-19 community level before we get there?
Yeah, it's a great question. So it's built into the levels, this bit of a runway. So as we look at going from low to medium to high, that progression, when we look at the values when we're in low right now, we can see, oh, it tends to take a few weeks before you have cases, before you have hospitalizations, after you maybe see an uptick in cases. And so that going from low to even medium, you have some runway where you can prepare for, oh, our cases are a little bit high. It's possible that hospitalizations will go up and hospitals can prepare accordingly. I will say with the current variant, there isn't as much of a connection between cases going up and hospitalizations automatically going up like we saw with previous variants. But it's certainly something that we like to keep an eye on because we know new variants emerge and we want to make sure we're on top of that. So the levels have that kind of advance notice built into the measures themselves.
And there's been a lot of conversations around masks too, and how those factor into transmission levels. So what recommendations does DC Health have in this new framework for wearing masks?
Yeah, so when the community level, so it depends on the community level that helps guide our decisions and our recommendations on masking indoors in public settings. So when the community level is low, the recommendation is that you don't have to wear a mask indoors in public settings. When the community level goes up to medium, which here in the district we were a few weeks ago, and now we're back to low, but when it's medium, the recommendation is that the general public still doesn't need to wear a mask indoors in public settings. But we do recommend for people who are at higher risk for severe disease that they should wear a mask indoors in public. And the people who are at higher risk for severe disease are going to be our older residents, especially those over the age of 65. People who have underlying conditions like chronic kidney disease, heart disease, pregnancy is actually considered an underlying condition as well. So those are people who are at risk for more severe disease. And then the third group of people are those who have immunocompromise. So maybe they've had an organ transplant or they're getting treated for cancer. They're on some medications that suppress their immune system. Those three groups are considered at higher risk for severe disease. Many of them know who they are and they're under the care of a provider. And so we would recommend that they wear masks inside when it's medium. Now, if or when we get to a community level of high, the recommendation is for all of us to wear a mask indoors.
So with DC's smallest residents unable to potentially get vaccinated, as you talked about, some of those that are the most at risk, how can our communities continue to use these community levels to protect them and all of our more vulnerable community members as well?
Yeah, so keeping track of that level and then knowing whether you should mask or not is going to be one of the most important things. The other group I should mention when we're in the medium level is that if you are somebody who has that high risk yourself, we want you to wear a mask. But we also say if you live with someone or if you are a close contact of someone who is at high risk, you also may want to choose to wear a mask around them, to monitor your activities and wear masks in order to decrease the risk of you getting infected. You might be fine, but then you could pass it on to someone in your life who is at higher risk for severe disease. So the way that we protect our youngest residents in particular who aren't eligible for vaccination is first and foremost to get vaccinated ourselves. That's the recommendation on every level. Be up to date with your vaccinations, which means being boosted if you're over the age of 12, being fully vaccinated if you're between 5 and 11, and staying up to date with all of the recommended vaccines, and then masking as appropriate to the level. And I also just want to add, of course, at any time with any level, people are always free in the District of Columbia and everywhere to choose to wear a mask for their own personal preference, their own personal tolerance of risk.
Where can residents find more information and resources about DC's community levels and COVID-19 in general?
So our website, coronavirus.dc.gov, has all of the data on what our current community levels are, as well as guidance for the community on when to mask and how to protect themselves and their families.
I'd like to thank today's guest, Dr. Anjali Telwalkar, the Chief Science Officer at DC Health. I'm your moderator, Ellie Rowe, and for more on this discussion, visit WTOP.com and search DC Health.